So today, I have the honor to introduce to you Vijay Daniels. Vijay is a professor and assistant dean assessment in the Faculty of Medicine and Dentistry. So please, Vijay, take it away.
All right. Yeah, so if you're comfortable turning on your camera, I'd love to see faces, but I also understand there's various reasons. I'm going to actually apologize to Jackie Layden that I didn't have my camera on at her talk yesterday because we were troubleshooting an air conditioning problem. All right, so welcome. You see my rather long title to the talk today. I do also want to repeat the land acknowledgement. Obviously, with so much in the news, we really do have to acknowledge the terrible things that have happened to our Indigenous brothers and sisters over the years. And so I think it is important to do these land acknowledgements, although that's just the bare minimum. And so again, the U of A is respectfully acknowledged. We are located on Treaty 6 territory, a traditional gathering place for diverse Indigenous peoples, including the Cree, Blackfoot, Métis, Nakota Sioux, Iroquois Dene, Ojibwe, Saulteaux, and Anishinaabe, Inuit, and many others whose histories, languages, and cultures continue to influence our vibrant community. In terms of disclosures or conflicts of interest, I do not have any as they pertain to this talk. And so let's get to it. So although 4 objectives might be a little meaty for a 15-minute talk, I'm actually going to be lumping up some of this together. I'm actually going to start with the case scenarios for where I applied self-determination theory to kind of set the stage. So our 3 case scenarios we're going to talk about today is first, when the COVID pandemic hit, we had reduced opportunities for our in-person physical exam teaching. And so we will come back to that and explain how we managed that. The second one was due to the COVID pandemic, we had quite a compressed timeline between when our final written exams of the 4-year MD program happened and the final performance exam. Normally they were several weeks to months apart to give a breathing room, but in this case, they were sometimes a day apart for students. And the last one was that performance exam I referred to actually took place during the week where the government announced going back to step 1, and there was a lot of stress that was associated with that. So with those case scenarios in mind, I'm just going to quickly review for those who are not familiar with self-determination theory, some of the underpinnings of it. So Richard Ryan and Edward Deci, it's actually SDT goes back more than 40 years. Some of the early papers I found was even 1980. And I will just say this is one learning theory that could be applied to these situations. It's not necessarily the best one. It's the one I'm most familiar with, which is why I'm presenting on it today. Self-determination theory has really become a macro theory with multiple mini theories. And mini theory 4, if you want to read more, the website information is there. It's a great resource. Mini theory 4 is the basic psychological needs theory that states that psychological well-being and optimal functioning is predicated on the 3 pillars of autonomy, competence, and relatedness. And any context that support versus thwart these needs will impact wellness, and all 3 are essential. And even if any one is thwarted, there will be distinct functional costs. So I'm going to talk a bit more of what that actually means as we continue. So in terms of the impact on learners, in terms of supporting these 3 basic psychological needs, if anyone is doing any work in health professions education, and especially has an interest in motivation, I would turn them towards David Cook and Tony Artino's 2016 review paper on various motivational conceptual frameworks. They do an excellent job of outlining this. And even if you're outside health professions education, I think this is an excellent review article. But the one image I'm going to be using throughout this talk comes from that paper, and it is as follows. One of the key principles here is the thought is, if we support basic psychosocial needs, we will move learners from extrinsic motivation to more intrinsic motivation, a process called internalization and integration. And you can see it there. When we use primarily external demands or rewards, it can be a very different motivation than if we can really move them to be intrinsically motivated, where they really enjoy the material, they actually enjoy the challenge and want to seek the challenge, they're curious and they're overall, again, interested in enjoying learning. So how do we do that? Well, one of the pillars, as I said, was relatedness, enhanced by respectful, caring environments, inclusive environments. For those who were at Dr. Layton's talk yesterday, universal design and learning is extremely important. That addresses some of that. Enhanced by optimal challenge in terms of setting the bar appropriately, a little higher than the learner's level. Making it too easy can actually undermotivate people, but making it extremely hard can also do the same. You may be wondering what positive performance feedback and negative performance feedback means. Negative does not mean constructive. It means overly critical or just focusing on the negative as to why the learner is bad. Positive is in both valences of here's things you did well, but here's also some areas you can work on. And the positive refers to thinking through towards how they're going to improve down the road. And the last being autonomy. And this is enhanced by choice. It's a big one I always look towards. Where can I give learners choice? Explanatory rationales. When you can't always give them choice, at least they feel like they understand the reasons for this, and acknowledgement of feelings. And you can see here all the things that undermine. And sadly, you may think of your own classroom settings where maybe this is used, unfortunately, too often. So this is a figure we're going to come back to throughout the talk. And now I'm going to jump into the 3 case scenarios and discuss how I think consideration of self-determination theory can guide how we address these problems. So the first are these mispractice sessions. So to illustrate this, I'm going to tell you about Dave. So in spring of 2020, when the pandemic hit, Dave was a second-year med student. And in the fall, Dave was about to enter what we call clerkship, where he's out of the classroom, he's on the wards, in eMERGE, in clinics, seeing real patients supervised, and having to actually apply his clinical skills that he had learned in first and second year. And towards the end of second year, we do some review sessions to get them ready for their performance exam, which is called an OSCE. But COVID hits and the physical exam teaching, especially these consolidation sessions, got put on hold. Now, students were intrinsically motivated already to try and tackle this on their own. And many students were forming study groups through the summer. And in fact, it was odd. I actually had to send emails being like, be careful in your study groups, right? We are in a pandemic. Make sure if you have PPE, you should be using them, washing your hands frequently. But Dave's situation was a little unique because Dave had a family. He had a partner, he had a child, and he expressed that he was quite concerned about getting together with his peers in med school in order to study, even if they had masks and lots of hand washing. So what was our solution? Well, our electronic assessment system had already been undergoing a bit of a modification. In the past, we had set up these OSCEs, performance exams, where faculty members were the examiners and the students, of course, were the candidates. But what we did is we actually modified the system so that the students could play the role of an examiner, pull up cases. An example would be, you're seeing a patient who consumes a lot of alcohol, please examine for signs of liver failure. And so the student could pull up the case, pass the score sheet to a partner who's not even in medicine and say, I'm going to practice this. I want you to score me and give me feedback. Now, obviously, a layperson is not going to give the same richness of feedback as someone in medicine, but it still allows an opportunity there. So what did students think? Well, I polled the students who had used the system last summer. Here's one. I use the system to practice with various OSCE checklists with my partner at home, not in medicine, and it was very helpful because the system, they could score me on the system as if it was the real exam, and then it was helpful for me to review the checklist afterwards to see what they missed. Another one said, I liked it because it allowed me to practice with my friends outside of med school who were in my cohort bubble and receive feedback on how I was doing. So coming back to this, I would maintain why this worked so well and supported students is because it was an inclusive environment, especially in a pandemic where people were felt unsafe. It gave them security to know they could still practice their skills. It could still give them somewhat of an optimal challenge. Again, not the same as being scored by a peer in medicine, but still they get access to the score sheets, get feedback, and then they had the choice as to how much to engage with the system or how much they didn't want to. And there was variable uptake on that part. That's the first scenario. Second scenario, exam burnout. With this, I want to tell you a bit about Sally. So Sally is a fourth year medical student, and she's about to write her final written exam on a Friday of the week. This is the same week as her final OSCEs, the performance exams that were happening on either Wednesday or Thursday. Sally reached out to me because unfortunately, due to the COVID pandemic, Sally's had a lot of psychosocial stress to the point of developing a true sleep disorder and extreme anxiety. And it was to the point that she could not focus. And her question to me is, can I defer? What was interesting is Sally had been going through clerkship, seeing patients. So the real life seeing patients and the clinical skills she felt comfortable with. And so she felt that despite her anxiety and sleep disorder, she could do the performance exam. It was sort of the same thing she'd been doing for the last 2 years. It wasn't really a drastic change. But to sit down and study for book knowledge was quite different given her sleep disorder. What's also I thought was important to know, in my role as assistant dean, I had access to Sally's entire portfolio during med school, and Sally had always been a very strong student. And I bring this up because if a student was sort of just getting by, I may have made a different decision than what I chose to in this case. So what was the solution? Well, first and most importantly, listening and validation. I was very tempted to be like, Sally, it's going to be okay. Like that was just sort of my gut human thing. But I was like, no, I can't tell her that. Sally, you have a legitimate medical condition. We know what the cause of it is. This pandemic's just brutal on people, and it will impact your performance. I'm not going to lie. You will do worse on this exam. And she was quite appreciative that I just called a spade and said that. But then I also reframed expectations. Sally always held herself to a higher standard than the bare minimum, which we want all our students to do, of course. But I had to say to her, Sally, I don't want you to not take this exam just because you won't do as well as you'd like to, because our medical schools pass fail. Although we obviously want people to do more than just pass. At the end of the day, as long as you pass, you are granted an MD degree. So I gave Sally a choice. Sally, you can choose to take the exam on Friday, and if you fail, it will not count as your first attempt. In the MD program, we've moved to every exam you get 2 attempts. And so the first attempt is not as high stakes, but in Sally's case, she thought it was. If I lose this attempt, I'm only going to have one more attempt. I told her, no, I will, if I have to write a whole new exam to make this work or do an oral exam, we'll get it done. But I also said to her, Sally, if you wake up on Friday and you just had a brutal night's sleep and you cannot write this exam, you don't need to write it. Just let us know. We will figure out. I will not be upset with you. And I just told Sally, this is your choice. Sally was not unique. There was actually a couple of Sallys in the class this year. And so what happened with both Sallys? Both chose to sit the exam. Both did just fine and passed. And they didn't do as well as they had traditionally done, that's for sure, but they did well. So how did this example exemplify some of the parts of self-determination theory? Well, again, choice is key, but I think what's really important is acknowledgement of feelings. Sally was very understandably stressed, but I'd like to think I gave a very respectful and caring environment to support her through this. The last example is going to take a little bit more time to explain, and that's about the third wave and how it impacted that final performance exam. So I'm going to bring you back to the week of April 5th. This is when really we're seeing the COVID variants are on the rise, and very understandably, I had fourth year med students emailing me to say, are you sure you're going ahead with this in-person performance exam on Wednesday, Thursday? And again, I tried not to just have a reflex, well, of course, or no, this is crazy. I thought it through. And one of the things to understand is the exam is a 1-hour exam where the examiners are all been double vaccinated. Most of our ACTR standardized patients are older, and so they've had at least 1, if not 2 vaccines. But the students, I don't think had all had their first vaccine yet. Med students were not considered healthcare workers in the pandemic. So totally understandable that they were concerned about themselves. However, they had been working for almost 2 years, seeing real patients with COVID in the hospital, in Emerge, in clinic. So I sort of was like, this is actually safer than a trip to the grocery store. Everyone's wearing full PPE. Everyone's been vaccinated, but you. Again, I knew that I can't just glibly say that, but in my head, I'm thinking this. So I actually developed a 15-minute video, and actually most of the class actually watched it to answer questions like, why do we need an in-person exam? What are the PPE? What are we going to do if a student's exposed? Am I going to have to take 2 weeks off my learning? And the examiners wanted to know the same information. So I tried to address every question I could think of that they'd be concerned about. I thought it worked well. My associate dean, who I answer to, and the dean of the faculty both thought the video was great. And then April 6th comes and the government announces we're returning to step 1 of restrictions. All social gatherings need to be kiboshed. We're going all the way back. And of course, not surprisingly, students were quite upset and frustrated because they sensed I was going to just keep going forward, which I was. But unfortunately, things got a little over the top on social media. And there was a lot of anger out there. I'm not actually on social media, but my dean is, and she was telling me there's some very upset students. We had students email from an anonymous email account saying, if this is the last thing you do for us as our class, you better make sure you don't make us do this exam. And it was really this, like, as an instructor, I'm feeling emotions of anger, but at the same time, I'm trying to be understanding. So later that evening, I get a couple of emails. One student says, forgive me for emailing on your personal time, Dr. Daniels. I'm so disheartened by many of my classmates' posts I'm seeing on social media. It's staggering to me the level of disrespect and entitlement I'm witnessing. It was really nice that somebody at least was calling it out. And another student said, I just wanted to let you know, I love this one. I chuckled. Not all of us are trying to make your life difficult. I'd really prefer just to write this exam tomorrow. I see no reason not to. Thanks for all you do. I think you've been more than generous enough. And I'd already made changes on the fly on Monday to how the exam was going to go down. So I apologize that this is long, but I think it's helpful to understand. This is the email I wrote. Let me begin by saying your safety is our first concern. I take this announcement about and the emails I've received from all of you this evening very seriously. Based on our assessment of the risks and the details of announcements, we still feel it's safe and aligned with these restrictions to proceed with the exam tomorrow and Thursday. However, I understand there's differing views and feelings about this. We want to be as accommodating as possible. So for this reason, if any student feels taking the in-person OSCE this week is unsafe, let us know. We will reschedule you for the makeup slot, which is May 15th, and that'll be your first attempt. You don't lose your first attempt. So what happened? The exam ran really smoothly. Only 4 out of the 165 students deferred due to safety concerns, which is what I sort of expected. And even though it seemed like a lot of work, I think it was worth it for these 4 students who really didn't feel safe. An expected number of students failed the first attempt, which is why we really need the first attempt early, because we needed to set remediation plans so that people could take the second attempt and graduate on time, because we were getting really close to convocation deadlines here. May 15th comes. Those who struggled on the first attempt and those who deferred sat their makeup exam. All the students passed. And what I'm most proud about is we successfully graduated a full class of students with an MD degree without compromising our standards. So this example to me shows obviously respect and caring. I'll be honest, as an instructor, there were times I was angry and frustrated, but I had to keep reminding myself where the student was at, giving them that optimal challenge. Students came to me afterward and said, I'm really glad you made us take this OSCE. It was a tough exam, but it was a fair exam, but it makes me realize I am the doctor. I deserve that MD now. But giving them choice where we can defer, explaining, why do we have to do it in person? And of course, continuously acknowledging feelings. So that's my 3 stories, and I'd love to open up to questions at this time.